It's way past midnight, and I'm staring at my screen, trying to edit interviews and write a script in time for my production team to stitch it into the next podcast episode. My stomach growls. I reach for my phone and open Blinkit. Within minutes, I've ordered a pack of chips and a can of soft drink. 10 minutes later, they're at my door. And in 15 minutes, I'm doing 3 of the unhealthiest things a person can do to their body. Being awake way past midnight, working when my body and mind need rest, and consuming the worst kind of food at the worst time possible. I'm not alone in this. In fact, I'm far outnumbered by young Indians or Gen Zs who enjoy this convenience and its fruits almost like a ritual. A study by community platform Local Circles reveals that nearly half of packaged food items on India's quick commerce platforms are either junk or ultra-processed or HFSS, which means high in fat, sugar, and salt. The study, covering 24,000 parents across 277 districts in India, found that 39% of households report Gen Z family members regularly ordering ultra-processed foods. That's your soft drinks, chips, instant noodles, and ice cream, all through these quick commerce apps. But then, 9 in 10 parents believe that an identifier of such foods on these platforms would help Gen Zs make healthier choices. And yet, regulatory action remains painfully slow, primarily as the makers of these foods do not want to warn people of their ill effects and dent their profits. And of course, online marketplaces are only too happy to see growing volumes, no matter where they come from. In this episode, we try to dig deeper into the problem and look at possible solutions with the founder of Local Circles and a public health policy expert. It's Friday, the 12th of December. I'm Anirban Chowdhury. This is the Morning Brief. First up, Sachin Taparia of Local Circles. Hi Sachin, very warm welcome to the Morning Brief.
Good to be here, Anirban.
We are talking about your report, which is quite revealing in its nature. It actually confirms my worst doubts because I've had phases where I've really binge eaten at night, and the stuff that pops up whenever I open Blinkit or Zepto are the unhealthiest kind of junk foods, and now there is data to bear this out. Now, let's start from basics. What percentage of packaged food items on quick commerce platforms in India are classified as junk or HFSS or ultra-processed foods? And according to your findings, which platforms have the highest percentages?
So we have done extensive research on this, Anirban, over the last 6 months. And as these listings on platforms change, we have kind of kept them updated, basically. And what we find is that 1 in 2 of the packaged food listings on quick commerce and online grocery platforms in India today are of junk, ultra-processed, or what FSSAI calls in India HFSS, which is high-fat, sugar, salt foods. And the top offenders are basically Blinkit at 62%, followed by Zepto and followed by Swiggy Instamart in terms of the highest percentage of foods that are listed on these platforms falling in the category of HFSS or ultra-processed. And then you have all the others, basically. But the range goes from 62% of the foods to really, 47, 48% of the foods for folks like Amazon and Flipkart Minutes and such. So it's extensively high across the board if you look at any platform. Your chips, your ice creams, your sodas, your noodles, all of these foods.
Why do you think this is the case?
So, a lot of shopping that happens through these apps is discretionary or impulsive shopping that is actually happening. So, when people realize that it's 9 o'clock in the night and they want to have ice cream, they basically are going out to these platforms looking for that ice cream. And in the process, they are also adding other foods, which could also be from the ultra processed or HFSS category. So a lot of discretionary, impulsive buying is happening through these platforms, and people are looking for these type of products when they are doing that.
So the consumers of this are mostly Gen Zs. How did you find that?
So we've been getting a lot of posts and comments over the last 12 to 24 months on this subject,
Mm,
where parents have been writing about how their kids, especially teenagers, are hooked to these apps. And a
mhm,
lot of it is happening in after hours, late hours. And essentially, it is not a once in a while phenomena, but it's become almost a regular phenomena where for some parents, especially in Delhi NCR and Mumbai and Bangalore, large cities, we are seeing that parents are complaining about kids placing 2 to 4 orders in a day. So it's not the typical household grocery stuff. It is these impulsive foods and impulsive food buying that is actually happening through these apps. That
mm.
children across the country are consuming, at least in these big cities, tier one and tier two, and now even tier three cities, we are seeing a lot of these kind of posts coming from parents. And literally 39% of the parents in our study have basically said that they are seeing their Gen Z regularly ordering on a pretty regular basis. So the phenomena is spreading, and we are seeing this growing because this number was at about 23% when we did the study back in 2023. And it's
Mhm.
gone from 23% to 39% over 2 years, which is a significant jump.
All right. You started your first answer, by calling these quick commerce apps offenders. Now, if I were to ask them, they would just say that we are just a marketplace and we are catering to demand. And if there is a high growth in demand among Gen Zs for this kind of ultra processed food, I mean, what can we do? How do you see this?
So, see, I think there is, of course, demand for these kind of products. I think the bigger question is that when Gen Zs are out there, when somebody goes and searches for a chocolate online, right? If you start showing them, let's say, hundreds of different chocolates, essentially, different options that are out there, the choices are many to pick from, which may not necessarily be true in the offline world. Now you have access to 50 types of chocolates. And if you multiply that across, different platforms, there's a lot of variety now. And one of the top issues here is basically that you have all these choices and almost all of them are in the HFSS category. So why aren't platforms putting in an effort to, just like they would list, let's say 40 types of potato chips, to also list 40 types of maybe healthy snacks and essentially identify for the consumers what is a red or an HFSS food and what is not, right? Does that mean they will not have potato chips? Absolutely not. But if out of 10 ordering cycles, if three became not ultra processed, healthier food options, and seven still stayed whatever they were ordering earlier, I think we'll all be in a better place.
Got it. And to that end, you have spoken about the red identifier system. What is it? How does it work? And is it under our regulatory framework as well?
So we've had one discussion with the regulator on this subject back in 2024. And one of the open asks that we have with the regulator today is to have the front of the pack label on the physical package of the food. So that is under consideration. FSSAI is working towards it. They've had consultations. They've gone back and forth between should we have a star system versus should we have a front of the pack label system. Here, what we are saying is that the same concept, because that packet is not really visible to the consumer or they may not click on it, at least for all the online platforms identify such foods with a red bar, so the consumer, just like they see veg versus non-veg, They are able to see that this is a red food versus this is a not red food, or even better would be an orange or a green food, right? So we're going to make a submission, a formal submission to the regulator this week, requesting them to implement this. It is not that hard as compared to the FOPL, which is more physical in nature, where every product, every packet has to have a red label. They should be relatively straightforward. So I think if the regulator began that process and over a year's time implemented it or got all the platforms to implement, I think we'll be consuming more healthy, at least over the coming years.
And what do these youngsters' parents feel about implementing these red identifiers?
So, given the pace that this 23% has become 39% over the last couple of years, what is happening here is parents are realizing that though, the Gen Z in their household is not ordering these products regularly, to now you're using it, 2 to 3 times a week. So if you look at the breakdown of the 90%, 54% have basically said they are in total support of this red identifier, and 35% have basically said that, this will lead to increasing chances of they ordering healthier, or about 35%, making it to a total of about, 89%.
But Sachin, before we go there, even basic warnings and labels are taking so much time to be put in place by the companies or being mandated by the government. For instance, why is it taking so long to implement this front of package labeling? I mean, it's the easiest and the most important thing to do as far as food awareness is concerned. So this is clearly a mix of lax implementation, but also pushback from companies, right?
So there is a massive pushback where the companies want the food brands, especially the ones who are engaged in the manufacturing of HFSS or ultra processed foods. They want a star system, which essentially means that a consumer will have to go to the back of the pack and look at whether they are consuming a 3-star food or a 5-star or a 1-star. The consumer bodies and many of the consumers, they believe that the star system is not going to make much of a difference. Nobody's going to be able to understand that. While if there was a red bar, at least there is some chance that somebody will start asking, what is this red bar? And over time, people realize that this is something that is unhealthy. So that's where we are, where the consumer bodies and the consumers want the front of the pack label, while the brands basically, they believe that there is going to be a loss of revenue, loss of sale for the products that they are manufacturing. So that's why I think that it's taken almost 3 years now since our original submission to the government for they to come out and at least say that, look, we are implementing the star system anyways, but we are going to have a front of the pack label, at least for the red foods or the HFSS foods. So I think they've said that. Now it's a matter of converting it into a real implementation on the ground.
The local circle's findings are not isolated concerns, of course. They're part of a global crisis documented in the Lancet's comprehensive series on ultra-processed foods and their impact on human health. The research is damning. Ultra-processed diets are linked to several dangerous chronic conditions, from diabetes to depression. And these foods contain cosmetic additives that trigger addiction and overconsumption. Of course, food industries across the world have enormous power and sway, and they have managed to thwart regulations through lobbying, litigation, and commissioned studies that give them a clean chit. India is, of course, better than the West in this, but it is at a critical juncture. More on all of this in my next conversation with Dr. Arun Gupta, founder of Nutrition Advocacy in Public Interest, which works on food policy issues. I started by asking him about the latest findings around health risks associated with ultra-processed and HFSS foods.
So there is a recent analysis done by the Lancet series. They identified 12 diseases linked to the higher consumption of ultra-processed foods, which are mostly high fat, high sugar, and high salt foods. Mm-hmm. So it's in addition to, there is supposed not only by the sugar, salt, and fat content, but in addition to that, there's other cosmetic additives like colors, flavors, emulsifiers, etc. So the diseases which are found to be linked with this are First is the over gaining weight, like you gain excess weight, and once the excess weight happens, then the others also stop coming into, like type 2 diabetes, hypertension, disturbance in your lipid profile, and the cardiovascular disease and related mortality, coronary artery disease. All these actually are found in these studies, and including kidney disease and depression also. So not everybody suffers from everything, but these are the areas which get affected when the persons increase their intake of such dietary patterns, which include a lot of HFSS pre-packaged. We call them now ultra processed. So if younger generation consumes it, they are probably risking a lifetime risk to their health. So that's why it's a big problem to my mind. The Indian ultra processed food growth in sales has been the fastest, among the fastest in the world in the past like 10, 15 years. So WHO study found it is growing at the rate of about cumulative annual growth of about 13.3%. So India must be cautious. India must be curious to change this pattern. So it's about the dietary pattern, not an occasional somebody eats somewhere. So we should be worried about the dietary pattern, which contains more than 10% of food products in your diet. So why it happens? That the moment we start consuming these products, they start displacing our whole food and real foods. So once that whole food and real food is displaced, and then they disturb the quality of the diet.
Got it. From a public health standpoint, how do you view these platforms that are becoming
Hmm.
de facto digital corner stores and the fact that they have no nutritional guardrails?
You can't close the shops, right? Same way you can't close these platforms. So the point is that there is a need to have a serious regulation on the production and marketing and promotion of such products, which will probably put some deterrent to the sales of these products, which include, like, for example, warning people that they are high in fat, sugar, or salt. In some countries, they mention that this product contains caffeine. In Mexico, in Chile, they say this product contains sweeteners. And these kind of warnings, they have to come up. India is still sitting on a front of the pack warning label for more than 10, 12 years. I think it's easier to do it as fast as possible. But why can't the government do it? Because there is a lot of industry pressure on them, which is visible. Industry doesn't want such warnings because it affects their sales. So there are two interested parties here on the public health standpoint. That one is interested in public health, is the mandate of the government is also a public health mandate. On the other side, the interested party is the food industry, which wants to increase sales to make profit out of it. So they are not concerned about the health of people, whether they're children or growing up adults or adults. So this is something serious. And secondly, the most of the consumption is linked to, there are studies which show that the products which are advertised are consumed more. Advertising using celebrities, advertising projecting these foods as healthy. Projecting them as food is another problem, but projecting them as healthy is a serious problem. Recent example of a cola drink, say, after the GST reduction in price, they increased the volume from 250 ml to 400 ml in the same 20 rupees. So in a way, they increased the chances of getting overweight by more than 150%. We have recommended in 2017, the Ministry of Health recommended that advertising laws should be amended to include HFSS foods. That is still pending. I think it's a time that 26 should bring in some serious effort from the government to show that they worry about public health.
Got it. And finally, can quick commerce platforms do something in terms of warnings or,
They
statutory
will not do
messages?
unless there is a regulation. I mean, I would love to do if the quick commerce people want to hear from us and they take action, they can label them, these are high sugar, high product, which is very easy to calculate. But They would
course.
need a definition of that, right? So the government has to give a definition of what is an ultra processed food, what is a HFSS, and then there can be an effort by the platforms that these foods are ultra processed or these foods are HFSS. I don't see voluntary effort coming up much because voluntary regulations have failed all over the world on this matter.
So, the chips I ordered last night arrived in 9 minutes. The front of pack warning label India needs? Still waiting after 12 years. Meanwhile, as online commerce rewires not just brand loyalty and consumption patterns of the youth, but also their eating habits, immunity, and longevity, the key question is, will a solution come before an entire generation's health is jeopardized? That's it for today. This episode was produced by Vinay Joshi, sound designed by Indranil Bhattacharjee. A new episode of The Morning Brief drops every Tuesday, Thursday, and Friday, wherever you get your podcasts. Also listen to ET in the Valley, our limited series every Wednesday, where we talk to the coolest entrepreneurs in Silicon Valley. And of course, on every alternate Monday, you have Corner Office Conversation, where we talk to the most interesting business and thought leaders in India and the world. Stay tuned.